Hey everybody, it's Katie Harris from Philly Wellness Center, and today we're addressing skin laxity with the revolutionary T-shaped device. So I want to explore how this technology is helping aesthetics meet the growing demand for skin tightening treatments, particularly with all of the weight loss that everybody's been going through, which has been great, but it does have its effect. So we are experiencing the GLP-1 effect in aesthetics. So there's been increased demand for these types of procedures, making it a very integral part of what we do. So this observation observes what many of us are seeing in this industry. So that rapid weight loss achieved through GLP-1s has created a new challenge, which is skin laxity, and that doesn't respond to diet and exercise. So, if you look at the data, the weight loss drugs, have just absolutely surged, right? The amount of money that Americans are spending to lose weight is unprecedented, mostly because the GLP-1s, they work and they're amazing for what they do. Our research has shown that 84% of Americans have wellness goals and 26% are planning to use GLP-1s. And even among different age groups, and Gen Z leads with 37% planning to use the medications, but even baby boomers are looking at these medications, coming in around 30% of GLP users. So the trend is directly impacting aesthetics and patients, if you're on GLP-1s. So this is a something that is coming up. So you start seeing it more and more. So the aesthetics industry is really looking into this, like how can we help what is going on? Because ultimately, you know, going from a full face or a full belly to skin laxity isn't necessarily a better look. It's healthier for sure, not to have all that excess weight, but the extra skin really makes you look older, aged. So it's something that's really important to address. And these images illustrate the common laxity issues that we're seeing in patients who have experienced rapid weight loss. So note the loose skin on the face, the neck, the arms, the abdomens, the thighs. These, again, typically won't respond to further weight loss or diet and exercise, and they require targeted intervention. So most people don't want to go for any kind of surgical procedures, but there's a lot that we can do to help this type of skin laxity. So this is what you're seeing. There's a lot that we can do that it does not involve surgery in any way, shape, or form. So we've done clinical studies looking at T-shape in particular, because this machine is quite novel, it's quite different, and it's more advanced than anything that's out there. So the focus of the clinical studies was finding a non-invasive treatment that delivers consistent, measurable results with high patient satisfaction. So that's what this is. This is the TShape2. It's an advanced multifunctional system designed for face and body contouring. It's an FDA cleared class 2 device, so you do have to be a practitioner to purchase something like this. It's not really something you would just have in your home, but it was created by the renowned Italian beauty device manufacturer, which is the Baldwin Group. And this has been around in Europe for a long, long time, very popular, very common procedure that's done there. So what makes the TShape2 unique is this integration of 4 advanced technologies into one super system, which offers a completely non-invasive treatments with no downtime for patients. So a lot of these things exist, right? You can get bipolar radiofrequency, you can get low-level laser therapy, you can get endemic vacuum suction, you can get mesospheric therapeutic activation, but this would be 4 different treatments at 4 different places. This is one machine, one device, and one treatment all rolled into one, which is really, really nice. So you had those 4 technologies. The bipolar radiofrequency delivers controlled heat to the skin's deeper layers, stimulating collagen and elastin. So that's its purpose. And that makes the skin tighter and smoother and very predictably. This is something that's been very widely studied for a long time. So we know that that works. Low-level laser light therapy delivers a low-intensity light energy to the skin, which stimulates cell regeneration, ATP production, and blood flow, and which also helps promote collagen production and skin renewal. Your endodermic vacuum suction massages the skin using gentle controlled suction and rolling movements to stimulate the skin and underlying tissues. So this will improve lymphatic drainage, blood circulation, and reduces fluid retention, which is extremely helpful, especially throughout the body, but a lot in the face as well. It's quite impressive the number of people that after you do a facial with this have to go to the bathroom because you move so much fluid. So it's pretty neat. The Mesospheric Therapeutic Activation massages the body using a handpiece with rotating spheres designed to encourage lymphatic drainage, improve circulation, and promote collagen production. So how does it work? The science behind TShape2 is very impressive as well. It has effects that reduce swelling through its anti-edematous properties, improves circulation, and promotes skin health, which it helps address cellulite and connective tissue issues, right? So cellulite's been a pretty difficult thing to treat in the past as well. And this machine is designed for cellulite and skin laxity, two of the two things that are like the bane of aesthetics because it's been very hard to treat these. But now we have this device. So the device influences fat cells or adipocytes to release fatty acids more easily. These fatty acids can then be broken down by the body through lipolysis, which is promoted by certain hormones. So interestingly, the device also affects muscle thickness in the abdomen, making the muscle stronger and increasing the ratio of muscle to fat tissue, which will give you a more defined look. This was confirmed by ultrasound measurements in clinical studies that were done on this machine. And lastly, the device uses vibrations, radio frequency, and laser stimulation to activate specific receptors in the muscles, which improve muscle tone locally. All right, so the clinical study was designed to evaluate the efficacy of TShape2 for improving signs of skin laxity and sagging. So they enrolled 20 healthy female subjects between the ages of 40 and 60 who displayed signs of skin laxity and sagging in thighs, arms, and belly, either due to quick, moderate weight loss or just general aging. So each subject underwent 10 T-shape sessions, scheduled twice a week, allowing us to track progress consistently throughout the treatment period. So the key findings here, I mean, the results were quite remarkable. So after just 10 treatments, 85% of participants showed visible improvement in skin laxity. Skin firmness improved by an average of 30% across multiple measures. The dermis increased by 10% as measured by ultrasound. And this is particularly significant as it increased the dermal density that correlates directly with improved skin elasticity and firmness. All participants, 100%, reported that their skin felt firmer and showed less sagging, while 95% said the treatment reshaped their body. So in essence, the treatment delivered firmer, tighter, smoother skin that patients could actually see and feel. And that's pretty impressive. Like getting results like that from any machine is incredibly impressive. So from the patient satisfaction results, the subjective evaluation results were equally impressive, with 90% of the patients reporting more hydrated and elastic skin, 100% reporting firmer skin with less sagging, 95% showing their skin appeared plumper, and all participants agreed that the treatment was effective in reducing skin sagging, and 95% found it was effective in reshaping the treated area. Overall satisfaction was universal, with 100% of participants expressing satisfaction with their treatment results and 90% saying they would recommend the treatment to a friend. That's absolutely huge because there's very, very few procedures out there that would get resounding results like this. And it's actually a nice procedure. It's comfortable. It actually feels good. It's one of the few things that works that doesn't cause immense pain that you have to be knocked out for. You actually look forward to your session. So clinical assessment data, the clinical assessment included objective measurements using the DUB skin scanner to evaluate dermis density. So you can see there's a statistically significant increase in dermis density of 10% compared to baseline. So you can see on the ultrasound there's just more green, right? It's thicker, and that's quite impressive. So the ultrasound images that you see here show a particularly impressive case with a 24% increase in dermal density in the abdomen. So the top image shows the baseline measurement, while the bottom image shows the results after the treatment. So you want to note the increased density and organization of that dermal layer. All right, so, let's look at some before and afters, because that's what we all really just want to know, right? We want to know that it works, and will it work for you, and what does it look like when it does work? So yeah, I think these results really speak for themselves. So abdomen, so this is a very common area, especially as you lose a lot of weight in abdomen, you get skin laxity of that area, and losing more fat is not going to help this person in particular. We need to tighten the skin. Um, so here we see dramatic improvement in abdominal skin laxity after just 3 treatments. So that's really, really impressive. So this person was very happy with these results, but notice how the skin appears smoother with significantly reduced wrinkling and improved tone. The patient reported feeling much more confident in fitted clothing after these results, and who doesn't want to go walk out in a bikini with a body like this, right? So same here. These images also show improvement in skin laxity after just 2 treatments. So these rolls were causing a little bit of discomfort and affecting clothing, how it would fit. So we were able to create a smoother, more contoured appearance here. For arms, yes, it works for arms as well. The arm laxity is a common concern, particularly after weight loss. And these images show visible improvement after just 1 treatment. So imagine what 6 or 10 or 12 treatments would do. So you can see the reduction in skin sagging and improved skin texture. So patients typically report feeling more comfortable wearing sleeveless clothing after these treatments. And then, of course, the face, facial skin laxity, big problem after weight loss, because the face, everything kind of comes down and then it becomes more prominent. So you'll have some fat pads that are more hypertrophied, and that tends to be on the nasolabial fold. But then you get the jowls that kind of like sink down and stuff. And those are the things that we can address with T-Shape. But after 8 treatments, we can see significant improvement in jawline definition, overall skin firmness, and the patient appears more useful with a more natural looking result, avoids the overdone appearance, which, is something we do try to avoid. We don't want to have overdone looking, and this actually looks great. All right, so to summarize, the market for this continues to grow as weight loss spending continues to increase. So the clinical study that was done showed that 85% of participants experienced visible improvement in skin laxity. They measured an average of 30% improvement in skin laxity parameters. The dermis density increased by 10.6%, providing objective evidence of the treatment's effectiveness. 100% of users reported firmer skin with less sagging, and 95% said the treatment effectively reshaped their body. So the TShape2 represents a great way for you to address skin tightening treatments, right? Particularly among those of you that are taking GLP-1s. So this is a really, really great procedure. And if you're interested, please feel free to contact us at Philly Wellness Center, and let's get you scheduled with the T-Shape2.